Significant developments in the field of infectious disease research have shifted the focus of global health surveillance toward the mechanisms of hantavirus transmission, specifically concerning the Andes virus strain. For decades, the primary understanding of hantavirus centered on zoonotic spillover, where humans contracted the virus through the inhalation of aerosolized droppings, urine, or saliva from infected rodent reservoirs. However, recent evidence confirming that hantavirus can spread directly through human saliva has introduced a new level of complexity for public health reporting and household safety. This finding particularly affects couples and close family members, as intimate contact is now identified as a primary vector for transmission in specific geographic regions. While the majority of New World hantaviruses, such as the sin nombre virus found in North America, are not known to spread between people, the Andes virus found in South America has demonstrated a unique capability for interhuman clusters. This scripts the necessity for a broader understanding of hantavirus pulmonary syndrome, a severe respiratory disease characterized by a high case fatality rate. Historically, the medical community viewed hantavirus as a localized threat tied strictly to rural environments and rodent infestations. The confirmation of saliva as a viable transmission route forces a reassessment of clinical protocols, shifting the narrative from a purely environmental hazard to a communicable disease concern. Public health agencies are now analyzing how the virus utilizes the mucosal membranes of the mouth and throat to establish infection in a new host. In terms of time frame, this research builds upon observations from previous outbreaks in the Patagonia region, where secondary and tertiary cases among family members suggested a non-rodent pathway. For viewers and global citizens, this development is critical because it changes the advice given to those living in or traveling to endemic areas. It is no longer sufficient to simply avoid rodent-heavy environments. Those in close proximity to an infected individual must now observe strict isolation and hygiene protocols typically reserved for highly contagious viral fevers. The background of hantavirus itself involves a family of negative sense RNA viruses. These pathogens typically target the endothelium, or the lining of the blood vessels, leading to increased vascular permeability. In the lungs, this results in the rapid accumulation of fluid, a condition known as pulmonary edema, which can lead to respiratory failure within hours of the symptom onset. By framing the current findings within the broader context of virology, we see that the saliva-based transmission route represents a significant evolutionary adaptation, or at the least a previously underdocumented capability of the Andes virus lineage. This part of the report establishes the foundation for why this shift in transmission data is being prioritized by health officials worldwide. The core developments in recent hantavirus surveillance involve intensive laboratory analysis and the tracking of clusters by health ministries and international agencies. Scientific studies conducted in high-containment biosafety Level 4 laboratories have successfully isolated viral RNA from the oral swabs of patients during the prodromal phase of the illness. This is the period before severe respiratory distress begins, meaning individuals may be actively shedding the virus in their saliva while experiencing only mild flu-like symptoms such as fever, muscle aches, and fatigue. The implications for clinics and hospitals are profound, as healthcare workers must now consider the risk of exposure during routine oral examinations or the administration of respiratory therapy. Medical journals and official statements from regional health departments indicate that the viral load in saliva can be significantly high enough to facilitate transmission through shared utensils, kissing, or close-range droplet spread. This laboratory data contrasts with earlier, more conservative claims that suggested human-to-human transmission was an exceedingly rare anomaly. Instead, the verified evidence points to a consistent risk within domestic settings. Public health agencies like the Pan American Health Organization have monitored these developments, emphasizing that while the rodent remains the primary source of the virus in the environment, the human bridge is a critical factor in the size and duration of localized outbreaks. In terms of trade and logistics, while hantavirus does not typically impact global shipping due to its fragile nature outside of a host or reservoir, Local travel restrictions in endemic zones have occasionally been implemented during spike periods to prevent the movement of asymptomatic carriers. Laboratory testing has also evolved, with rapid RT-PCR tests becoming the gold standard for identifying the virus in blood and oral secretions. These tests allow for quicker triage, which is essential given that the window for effective clinical intervention is quite narrow. Data from hospital registries show that patients who receive supportive care, such as mechanical ventilation or extracorporeal membrane oxygenation, have significantly better outcomes, yet the diagnosis is often delayed because early symptoms mimic common seasonal viruses. Official statements from health experts reiterate that there is no specific antiviral treatment or vaccine currently approved for widespread use, making the discovery of the saliva transmission route even more vital for containment strategies. By focusing on the biological presence of the virus in the oropharynx, labs are providing the data necessary for agencies to update their close contact definitions, which now explicitly include those who have shared saliva with an infected person. This development underscores the tension between verified scientific data and the public's perception of risk, as the extreme risk to couples is not a result of a mutation in the virus, but a more accurate understanding of its existing behaviour. Prevention and public guidance are now being updated to reflect the reality of person-to-person transmission alongside traditional rodent control measures. For those in endemic regions, the standard advice remains to seal entry points in homes to keep out the long-tailed pygmy rice rat and other reservoirs, as well as using a bleach solution to disinfect areas where rodent activity is suspected. However, the new guidance for public health surveillance includes the immediate isolation of suspected cases from their family members to prevent the last kiss scenario or other forms of intimate transmission. Health officials recommend that during an active outbreak, individuals should avoid sharing food, drinks, or personal items that might be contaminated with saliva. Clinics are being instructed to implement enhanced droplet precautions, including the use of high-grade masks and eye protection, when treating patients with unexplained acute respiratory distress. Regarding the limits of current knowledge, it remains unclear exactly how long the virus remains viable in saliva after it leaves the body, or why some individuals seem to shed the virus more effectively than others. This uncertainty highlights the need for continued genomic sequencing to see if specific strains of the Andes virus are becoming more adapted to human hosts. Surveillance systems are also being expanded to include contact tracing, similar to that used for other contagious diseases, a step that was previously deemed unnecessary for most hantavirus cases. The global public health community remains in a state of cautious observation, as the potential for a hantavirus strain to gain more efficient human-to-human transmission remains a theoretical but serious concern. For now, the focus is on education and early detection. Calmness is encouraged by the fact that these clusters remain geographically limited and are not currently showing signs of pandemic potential. However, the severity of the disease necessitates a disciplined approach to hygiene and environmental management. Prevention is the most effective tool available in the absence of a vaccine, and understanding the risks associated with saliva allows individuals to take direct action to protect their households. As research continues into the molecular biology of the Andes virus, the priority for health departments is to ensure that both the public and medical professionals are aware of these transmission routes to prevent further clusters. For more updates on global health reporting and emerging viral threats, consider subscribing to this channel to stay informed on the latest peer-reviewed developments and official health statements. The core of current public health developments centers on a specific cluster reported to the World Health Organization on May 2, 2026, which has provided critical data regarding the saliva transmission pathway. This incident, involving the vessel MV Hondius traveling from South America, initially involved a couple from Argentina who had previously visited rural endemic areas. As of early May, the cluster has expanded to 8 infections with 3 fatalities recorded. Laboratory analysis of these cases has been instrumental in shifting the clinical understanding of the Andes virus strain. Unlike the more common sin nombre virus found in North America, which is primarily transmitted via the inhalation of aerosolized rodent excreta, the Andes strain has demonstrated a unique capacity for person-to-person spread. Laboratory teams at the CDC's Viral Special Pathogens Branch and regional South American institutes have successfully utilized RT-PCR and enzyme-linked immunosorbent assays to detect viral RNA and IgM antibodies in patients. Crucially, studies have confirmed the presence of the virus in the saliva and oropharyngeal secretions of infected individuals during the prodromal phase. This is the critical window before the onset of severe respiratory distress, during which a patient may exhibit only non-specific symptoms such as fever, myalgia, and fatigue. During this stage, the viral load in the saliva is sufficiently high to facilitate transmission through close contact, shared domestic environments, or intimate interaction. This verified evidence explains the specific risk identified for couples and household members, as the exchange of oral fluids or prolonged proximity to respiratory droplets provides a direct route for the pathogen to enter a new host's mucosal membranes. In the clinical setting, these developments have forced a rapid reassessment of triage protocols. Because the incubation period can last between 4 and 8 weeks, tracing the origin of an infection requires extensive travel and contact history. Hospitals in endemic zones are now categorized under high alert surveillance, as the transition from mild flu-like symptoms to full hantavirus pulmonary syndrome can occur within 24 hours. The physiological mechanism involves the virus targeting the endothelial cells that line the blood vessels, particularly in the lungs. This leads to increased vascular permeability, causing the lungs to fill with fluid, a condition known as non-cardiogenic pulmonary edema. Data from the Pan American Health Organization indicates that the case fatality rate for hantavirus in the Americas remains significant, with a reported rate of 25.7% across 229 cases in the 2025 calendar year. While no specific antiviral treatment like ribavirin has been proven effective for this syndrome, healthcare agencies have emphasized the use of extracorporeal membrane oxygenation, or ECMO. Clinical reports suggest that if patients are placed on this advanced life support at the first sign of respiratory decompensation, survival rates can reach 80%. However, the logistical challenge remains the limited availability of such specialized equipment in rural clinics where these outbreaks often originate. Furthermore, international agencies are monitoring trade and shipping routes out of South American ports to ensure that secondary clusters do not emerge through asymptomatic travelers. At present, the World Health Organization maintains that while the risk to the general global population is low, the verified proof of saliva-based transmission necessitates a more aggressive approach to household isolation and the use of personal protective equipment for anyone in close contact with a suspected case. In response to the verified risk of person-to-person transmission, public health agencies have issued updated guidance that integrates traditional rodent control measures with new protocols for human isolation. For residents and travellers in endemic regions, the primary prevention strategy remains the mitigation of zoonotic spillover. This involves securing dwellings against the entry of reservoir species, such as the long-tailed pygmy rice rat. Officials emphasize that any cleanup of rodent-infested areas must be conducted with extreme caution to avoid the aerosolization of viral particles. The standard protocol mandates that individuals should never sweep or vacuum dry droppings, as this can launch the virus into the air where it is easily inhaled. Instead, the area must be thoroughly soaked with a disinfectant solution, typically a 10% bleach mixture, for at least 5 minutes before being wiped up with paper towels. The use of rubber or plastic gloves and high-efficiency particulate air masks is strongly recommended during these activities. However, the confirmation of saliva-based transmission adds a secondary layer to these precautions. Public health directives now state that if a household member is suspected of having hantavirus, particularly the Andes strain, they must be immediately isolated from other residents. Practical takeaways for couples and families include avoiding the sharing of eating utensils, glassware, and personal hygiene items like toothbrushes, which may carry the viral load identified in recent laboratory oral swabs. Surveillance systems are also being scaled up to include rigorous contact tracing. When a case is confirmed, health departments now track all close contacts from the preceding weeks, monitoring them for the onset of febrile symptoms. This One Health approach links veterinary surveillance of rodent populations with human clinical data to predict potential hotspots before they result in widespread clusters. Despite these advancements, significant gaps in scientific knowledge remain. Experts admit that the exact environmental stability of the hantavirus in saliva outside the human body is not yet fully quantified. It is unknown how long the virus remains infectious on surfaces like countertops or shared items in various humidity and temperature conditions. Furthermore, while the Andes virus is the only strain currently proven to spread between humans, researchers are investigating whether other strains possess a similar, albeit less efficient, capability that has simply gone undocumented. This uncertainty underscores the importance of a transparent and ethical response from the public. Individuals who have been in contact with confirmed cases or who have recently visited high-risk rural areas have a civic responsibility to report symptoms early and adhere to quarantine orders. Early intervention is the most critical factor in reducing mortality, and late-stage reporting often limits the effectiveness of supportive care. The ethical close for public health reporting emphasizes vigilance over alarmism. While the term extreme risk highlights the severity of the disease, the actual number of human-to-human cases remains relatively low compared to other viral respiratory infections. The goal of updated guidance is to empower the public with the facts necessary to break the chain of transmission at the domestic level. By combining rigorous rodent exclusion with disciplined personal hygiene and isolation of the sick, the impact of hantavirus outbreaks can be significantly blunted. For continued coverage of emerging infectious diseases and detailed breakdowns of global health surveillance, consider subscribing to stay updated on the latest peer-reviewed findings and official ministerial statements.